So you did mention pulmonary rehabilitation or pulmonary rehab a couple of times in that. As a respiratory therapist, it's my opinion that that's one of those things that's fantastic, but very underutilized. So what can we tell people about pulmonary rehabilitation, why it's important, and how they might be able to access it?
So pulmonary rehabilitation is typically a 6 to 8 week monitored and supervised program. Maybe it meets 2 or 3 times a week for 1 to 2 hours. It's typically split between education and exercise. And the education that patients get includes everything from nutrition, when to call the doctor, how to travel with lung disease, how to use your oxygen, breathing techniques, how to use medications. And so that's the education piece. And then the exercise piece is a individualized monitored exercise program. So if this is in person, it's typically a gym-like setting with either stationary bicycles, treadmills, recumbent bicycles, some weights, free weights, some stretch bands, and somebody leading you through this, monitoring you, individually deciding where you need to start. It might be that you just start with a chair and you're just doing some light exercises in a chair. And maybe you move to doing a few minutes on each piece of equipment and you have goals each week. Now that some of these programs, many closed during COVID, but now they're returning. So some are back in person, some are virtual, and even as groups. So it's the same philosophy, the same approach. The goal of the programs are to improve your exercise capacity, so the ability to do more, whether it's how many minutes you can bike, walk, etc., decrease your symptoms, so decrease shortness of breath mainly, and improve your quality of life, that you now have addressed a bit of everything in a pulmonary rehab class. You've got social support, you've decreased your anxiety, you've realized I can get short of breath, but it's okay, I can work through it. I know how hard to exercise and when to cut back. You give you an analog scale like 0 to 10, keep your breathlessness around 4. So you have tools now to do this at home, because that's the goal, that you will take this from the rehab program and you will now have a home program that you will do at home, whether it be walking 30 minutes a day or walking 10 minutes twice a day, doing some light weights, doing a video, joining a maintenance program, which goes after the rehab program is stopped. Insurance typically covers pulmonary rehab, but not these maintenance programs. It's very important to keep it up or you lose the benefit. So there's been a fair amount of data published on pulmonary rehab outcomes, decreasing hospital stays, in some cases hinting at survival benefit. I don't know if that's been done in ILD, but certainly the benefits are well published, but you're right, it's very underutilized. And for oxygen, it's a huge asset. You have a one-on-one evaluation of your oxygen needs at rest and with exercise. Learn how to use the equipment, breathing techniques, etc. So getting the word out for pulmonary rehab is difficult. Even in the community, physicians, some don't think about it until a patient's quite ill. But we would like that to happen earlier.
So, well, hopefully this will inspire and encourage a lot of people to ask their clinical team about pulmonary rehabilitation, and hopefully we can get more people on those kinds of programs.
And Mike, I forgot to mention, there are many online resources to find a pulmonary rehab program. So, the Pulmonary Fibrosis Foundation does, and I know on the HES website for the oxygen resources, but the California Society for Pulmonary Rehab has a Find a Program near me, and as does the national group, the American Association of Cardiac and Pulmonary Rehabilitation. So those websites, you can go on and put in your zip code and find a program.